Good morning, I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress. We're here at day one, kicking off a morning of terrific speakers, and our first guest today in the studio is Dr. David Longworth. He is chairman of the Medicine Institute at the Cleveland Clinic. Good morning.
Good morning.
Well, at the Cleveland Clinic, at the Medicine Institute, in fact, you specialize in looking at practices to improve patient-centered care. Can you tell me what's being done at Cleveland Clinic that the rest of the sector could get some value in knowing about?
Well, at the Cleveland Clinic, value has become the core of our strategy. Figuring out ways to drive enhanced healthcare quality while at the same time taking cost out of the system. And we have a number of different tactics that we are pursuing in order to do that work, both in specialty care and in primary care.
Can you give me some specific examples? And I'm particularly interested, since we've seen the Affordable Care Act in motion now for 5 years, if you've made any specific changes to improve the care, and you've seen some good results from
We
that.
indeed have. In fact, we are fundamentally redesigning our care delivery model in both population health and primary care, as well as high-end subspecialty quaternary and tertiary care. And we're doing that in a couple of different ways. First, with regard to specialty care, we are developing care paths. We are developing standardized ways that we take care of patients to eliminate unnecessary practice variation and to take cost out of the system while at the same time driving quality. And we've seen results in a number of different domains where we've achieved just that.
What might we be interested in knowing about in terms of unnecessary practices? And was that surprising to you in what you found was unnecessary?
Certainly. Well, let me give you an example of that. When patients go to their primary care physicians or specialists with acute low back pain, the reflex is to image them, to spend a lot of money in getting an MRI or other imaging studies early in the course of their illness. And clearly the evidence suggests that unless there are red flag symptoms to suggest a major structural problem or an infection, for example, that those studies are not indicated. And so as we have rolled out a care path around acute low back pain, we've seen a significant reduction in inappropriate utilization of imaging studies and inappropriate use of narcotic medications, to the point where we have halved the cost of care for those patients.
Sure. Now, the Cleveland Clinic has always set a very high standard for itself, and the sector certainly recognizes that. Are you encouraged by what is happening in the rest of the area, rest of the space?
You know, I think I am encouraged, because I think for the first time in healthcare, providers really know that fundamental change is afoot, and those of us who went into healthcare really have wanted for a long time to do the right things for patients, and that is to drive quality and make care more affordable. We've got a lot of work to do, but you know, I'm optimistic about the early part of this journey.
A quick word on what you think still needs to be done?
Oh my goodness, there's so much that needs to be done. We need to figure out how to reduce inappropriate utilization. We need to figure out how to better communicate with one another so that transitions of care from one setting to another are optimal, so that we don't have unnecessary emergency room use or unnecessary hospitalization. We have to re-educate our caregivers about what this means, because it means practicing medicine in a completely different way than most of us were trained. And we have to educate patients too, because they're used to receiving care in a certain specific way, and it's got to be different moving forward.
Okay, Dr. Longworth, we're going to have to leave it there. Thank you so much for your time today.
Pleasure. Thanks so much.
And I'm Mabel Jong. Thanks for watching.